Dr. Matthew Grunkemeyer with Commonwealth Orthopaedic Centers. I'm here to talk to you a little bit today about hip arthroscopy. Hip arthroscopy is a newer technique to treat disorders of the hip, such as labral tears, degenerative tendon conditions, snapping hip, and recalcitrant bursitis around the hip that is not responsive to non-operative treatment. Also pre-arthritic lesions such as femoral acetabular hip impingement are all well treated with arthroscopy. These conditions can cause pain generally in younger patients with hip and groin pain especially. They can be due to traumatic causes or sometimes can be due to repetitive use over time. It's very important that you're seen and assessed, and a physical examination is important. I have a model of the hip here that demonstrates the complexity of the joint. This clear plastic shield represents the skin, then you have a layer of fat. Then underneath the hip joint you have a number of muscular layers that, as in this model you can see, will come off. This is represented by the gluteus musculature, the tensor fascia lata, the quadriceps as they come up and connect on the top of the hip joint. Also the lateral hip musculature and the gluteus medius, which powers the hip joint. You can have bursitis here in this area. That is a very common cause of outside or lateral hip pain. That can be treated initially with physical therapy and cortisone, but if it doesn't resolve, then an arthroscopy procedure can remove the bursitis and resolve some of the hip pain. Also there, as you get deeper into the hip joint itself, you can see on this model of the hip joint the labral cartilage. There's the ball and there's the socket. The labrum is this lining or lip cartilage that deepens the socket. As that cartilage gets torn due to an injury, it will cause persistent pain. This is not going to heal because it is surrounded by joint fluid and within the joint. That is probably one of the more common causes of hip pain in a younger individual and is treated with hip arthroscopy and surgery. What you would end up doing is use small cameras to look inside the hip joint, then manipulate the tissue and sew it back down to the bone to allow for cartilage to bone healing. Over the course of about 8 to 12 weeks, that cartilage would heal back down to the hip socket and would result in an improvement in patient symptoms. One could expect and hopefully find the ability to return to the type of sports and activities that you were doing before the hip injury with a successful labral repair. Of course, anytime you have a surgical treatment, you're going to have some internal scar and may not get 100% pain relief. This is a new and exciting technology that we're able to offer for our patients here at Commonwealth, and it is a nice treatment option that you can do to hopefully prevent, or if not prevent, at least delay the onset of severe hip arthritis, represented by this model, where the joint is painful, locked down, and sore, and of course the treatment option for that is a little bit more involved, like a hip replacement, and that would be the end stage of hip joint disease. The nice thing about an arthroscopic approach is hopefully you will delay or prevent the need for more advanced treatment options. Thank you very much for your time and attention, and hopefully you've learned something about hip arthroscopy.